I think that what we have right now in the Senate is a situation where the opposition party has made a political decision that we are going to say no to everything. We're going to not be at the table. We're going to just not get involved.
Which leaves you needing all 58 Democrats and 2 independents.
What that means is
every one of them.
Every single one of them.
Every single one.
Every single one of them. And look,
anyone can say to you, if I back off, you have to do what I need you to do.
You know, I spend a lot of time talking to individual senators.
Yes, you do.
And it's not just on health care. I mean, there are health care is the most prominent example, but you know, one of the.
But do you feel like they're holding you hostage on this?
Well, here's what I'll say. Each of them have very strong opinions.
Don't they ever?
And
you think?
You know, many of them, I think, sometimes feel that they've got a better idea than we do. We try to incorporate as many as possible. The problem is each one of them may have ideas that are completely contrary to what the other senator wants. And so there is a balancing act. You've got to have a sense on the part of each individual senator that every once in a while...
Do you think there's 60 senators doing that?
Well, I think it's hard. And there's got to be a sense sometimes that we're willing to rise above our particular interests, our particular ideas in order to get things done. Right now, that culture has, I think, broken down over the last several years, and one of my jobs over the next 3 years is to try to see if we can revive that. But that's tougher than I would have liked.
But when you need every vote like this, and when senators can do this to you, and those are my words, not yours, a lot of people worry that what you're going to wind up with is hash. There's even some Democrats saying now we've got a bill that's so compromised that it's not worth signing.
This will be the single most important piece of domestic legislation that's passed since Social Security. And I have confidence that we're going to pass it. There's a reason why 7 presidents and 7 Congresses failed to get this done. It is really hard, but it is going to get done. And if we don't pass it, here's the guarantee that the people who are watching tonight, your premiums will go up, your employers are going to load up more costs on you, potentially they're going to drop your coverage because they just can't afford an increase of 25–30% in terms of the cost of providing health care to employees each and every year. And the federal government will go bankrupt because Medicare and Medicaid are on a trajectory that are unsustainable, and this actually provides us the best chance of starting to bend the cost curve on the government expenditures of Medicare and Medicaid. So anybody who says that they are concerned about the deficit, concerned about debt, concerned about loading up taxes on future generations, you have to be supportive of this health care bill, because if we don't do this, nobody argues with the fact that health care costs are going to consume the entire federal budget.
Mr. President, thank you.
Thank you. Appreciate it.
Our conversation with the President here in the Cabinet Room of the West Wing this afternoon. Still ahead on World News, millions more Americans can soon be on a blockbuster drug. The study being called a medical game changer. A couple of big names cited and a couple of big year-end lists. And through the